Good morning. It's a pleasure to be here today and welcome everybody to this second annual symposium by the Jameel Institute, reflecting on the pandemic. And I'll just have a few introductory remarks before handing over to the first session. The theme of the symposium today is looking at the role of data analytics, but at the interface between science, policy and politics, and then thinking to the future as to what lessons we can learn in terms of global partnerships for making a more secure world in preparation of threats ahead. But just to start with, I'd like to offer some thanks to Community Jameel, who through a generous philanthropic gift more than 2 years ago founded the Institute here at Imperial College. And our aim is to apply data analytics to combat disease threats worldwide, more than just infectious diseases, indeed going to other forms of health emergencies as well. But clearly with the pandemic starting in early 2020, we have been dominated by responding to the pandemic, and through now I think over 100 scientific papers, many reports and a lot of bilateral work with governments around the world and with international organisations such as the World Health Organization, Global Fund and many others, providing support to countries around the world in dealing with this most serious pandemic the world has faced really since 1918. So the symposium today occurs just as the official confirmed death toll from the pandemic exceeds 5 million deaths worldwide, and that is almost certainly a significant underestimate of the true total, given that many countries don't have a good access to testing capacity and many countries' health systems have been overwhelmed at times. And so I think it's an apt time to reflect on the last 18 months, and as I said, to explore not necessarily the science itself, but how science has influenced policy, how it's been communicated to the public, the challenges faced in that, but also the successes, and then think about how partnerships have worked during the pandemic, very successfully I think on the scientific front, but perhaps with more challenges on the political and health action front. I should just offer a thanks to Roshni Mehta, who has organised this symposium and put a lot of work into it, and heads our communications team at the Institute. The first session will title Communicating Science in the Post-Truth Age, and I've put a couple of provocative pictures up here. But I'd probably start out by saying that in many ways, the pandemic has seen a burgeoning of public interest in science and is in some sense a golden age of science communication. I think there have been many successes that both scientists, journalists and communicators can be proud of, but there clearly have been many challenges. I'm not going to read the panel, but we have a very distinguished panel coming from multiple different sectors, but been all involved in science communication and to some extent in the intersection of that with policy making. Who will discuss this issue. Second, and I'm sure the panelists won't thank me for the pictures I dug out of them, we have a very equally distinguished panel, and this of scientists who've worked within governments in most cases to help their governments respond to the pandemic, representing three quite diverse countries: the UK, Anjana McLean, South Africa with Glenda Gray, and then Anders Tegnell in Sweden, countries which in some cases have been contrasted in their responses, certainly countries with very different social and cultural backgrounds and economic capacity to respond. And it'll be a very fascinating talk to find out the challenges they faced, both in acting as intermediaries between the wider scientific communities of their countries and government, but also in their personal interactions with policymakers. And finally, looking forward, and this I've shamelessly stolen from Nature as a graph showing the level of inequity of vaccine allocation through to about July of this year, showing the relationship between gross domestic product by country and the percentage of people at that time who'd had a first dose. We all know this, that whilst in many ways, the development of vaccines in response to this pandemic has been a triumph of global cooperation and investment. The distribution of those vaccines has been far from equitable, perhaps inevitably. Other aspects of the global response to this pandemic have also shown similar contrasts, with enormous amounts of scientific cooperation, but much less integration in terms of policy responses. And again, we have an equally distinguished panel who will discuss these issues, and particularly with a focus on the relationship between, let's say, the global north and the global south, and how this pandemic may have shaped and changed the nature of that relationship. And so with that, I'm going to hand over to Fiona Fox to start the first session a little bit early, and I will come back right at the end. I think we have 25 minutes allocated for me summing up. I will not take that long. I'll take more like 5 to 10 minutes, but I hope you all enjoy the symposium. Thank you.
Great, thanks, Neil. Can everyone see me all right and hear me, more importantly? Yeah, I just want to say thanks for inviting me to chair this event, because I think it's a really important time. It feels like we're really in that kind of moment of looking at what lessons we're learning and just being a bit more reflective about what worked and what worked less well. I've been looking at this very closely, and quite a lot of the discussion is about scientific advice. Did we get that right? The way different countries provided scientific advice to policymakers, what we actually did we go into lockdown too late? And I think there's been a lot less reflection and discussion about the communication of that scientific advice to the public and to the media. So I'm very grateful to Neil and whoever else put this agenda together, that communication is very much a part of the things that we're reflecting on and looking at, because I think it's really important. And I certainly am going to be kind of nagging some of the people setting up the official inquiry to make sure that the communication of that science, which was so vital during the pandemic, is at the heart of the lessons we learn. So with that said, the format of this session is going to be that each of the three speakers that you've seen on the screen will speak for 5 minutes each, just make some introductory comments to you. And then I will chair a kind of Q&A with them for about 15-20 minutes max, and then I'll come out to you. We've got a bit more time now because Neil was very brief in his introductory comments, so we should have at least a half an hour for you, the audience, to ask your questions as well and have discussions. So I'm going to kick off with Anjana Ahuja, who's known as Anj. Anj is a leading UK science journalist, formerly a Times columnist and now a freelance, covered the whole pandemic a lot for the Financial Times and other news outlets, and was a really brilliant science journalist in my view. There were many brilliant science journalists, but Anjana was definitely up there. More recently, some of you may have heard of her because she co-authored a book with Jeremy Farrar called Spike, the Virus versus the People, the Inside Story, which I want to highly recommend. It takes me weeks to read books these days, but it actually took me 2 days. It's an absolute romp of a read. You won't be able to put it down, so I do recommend you read that. So over to you, Ange, for your introductory comments.
And to the Jameel Institute for inviting me. And I'm beginning to reflect a bit more on the past year and a half. And I put together just some really brief observations. I hope I don't overrun, but Fiona, just interrupt me at any time. And the first thing I wanted to do, being a bit of a contrarian, is to push back on the title, which is Communicating Science in a Post-Truth Age. And I can only speak for myself as an FT science commentator, but my job is not to repeat what scientists tell me. My job is, it's not communicating in an unfiltered way. It is to interpret, to critique, to question, to interrogate, and to provide some context for what I'm reporting on. And that allows readers to make sense of a complex issue. And on the post-truth front, I think truth and facts and reality became very important to a lot of people during the pandemic, and certainly the number of people paying for subscriptions to the FT rose quite substantially during the pandemic, and we know from our COVID tracker, for example, that was very well received, and there was a real demand for it. So communicating science, the problem in the early stage of the pandemic was there was no single science. We're used to, as journalists, communicating a consensus. There was no consensus. Particularly in the early days, it was very uncertain, and that was down to the lack of data, emerging data, perhaps a lack of transparency about what was happening in China. So then you begin to question what you're communicating, because there is no science. So then you need to, I suppose, communicate why there is uncertainty and put some context around why there isn't a science to communicate. Another reflection, because this is about data, is I feel very strongly that data is not the story. You can take the same data and give it to 20 journalists and you will get 20 different stories. And I'm sure Fiona will understand this, because you ran the excellent science media briefings. I was at one for long COVID in children, and exactly the same stats were presented about maybe up to 32,000 children had a syndrome that was looking like long COVID. As some outlets reported it as a bad news story, which is that, finally we have confirmation that there is long COVID in children. And other outlets, and notably the BBC, reported it as a good news story because there were only 32,000 children with long COVID, as opposed to the 500,000 that had been thrown out as one possible statistic. So that's one thing. And I think once you understand that data isn't the narrative, it's kind of the ingredients of a cake. My job is not to serve the eggs, the flour, the butter, and so on. My job is to take data as ingredients and serve a cake, make it digestible for readers and give them some context around data and make it relevant to their own lives. And also the interesting thing about that is when you have data that can be used differently, that's where I think cherry picking and politicisation comes in. So once you understand that data is not the narrative, then things begin to make a bit more sense in terms of the way the science is communicated. The other thing I felt very strongly about was that data, in terms of how it feeds into policy, can only do so much heavy lifting. And you can have the best data in the world, like we did with the vaccines, the most effective vaccines in a pandemic, doesn't mean that people will use them. And I'm going to come on to that a bit later, but essentially, I think data, you have to be wary of it if you then use it to make policy for a population that you don't understand and that you don't necessarily know how to communicate with. And that came across very strongly, I think. One of the questions I was asked is whose responsibility is it to get the communication of the science, policy and so on right in a pandemic? I think it's absolutely the chief responsibility of a government to do that. They are the ones managing a public health crisis, and that is the basis of a social contract. I as a citizen have a vote, you have a vote, and in return for that liberty, we almost delegate the government to manage us. We give them permission to manage us and to make laws that curtail our liberties and so on. So I think absolutely the prime relationship here in terms of communicating with citizens lies with the government, and it should be clear public health messaging. And I think there are lessons to learn in some of the messaging on many things, but at the moment I'm quite occupied with what happened with the JCVI and teen vaccination, because I think that's not gone as well as it could have done. Journalists are not government spokespeople. We do wonder about where the responsibility lies for communicating clearly and responsibly. So it is not my job to do sort of press for the government and to do their job for them and to message people for them. My job really is to critique and interpret and so on, and perhaps say where the government's getting it wrong. And I don't think it's the job of scientists either to do the government's job of public health messaging. I think we all have slightly different responsibilities in that regard, but we can go on to that a bit later. One observation that I did notice writing Spike, which Fiona alluded to, was that scientists fell into two very clear camps when they were involved in policy about whether they should advocate one policy over another. And that made me think about many things, because one of those is about the Universal Code of Ethics for Scientists, which is out there on the government website. And I just wonder how many scientists, and this isn't a criticism, because if you're dealing with a pandemic and you're making policy and being asked to advise, It's very difficult to sit and have that reflection, but it made me wonder how many scientists went back and actually looked at that ethical code, and about whether that would influence whether they advocated policy or not. And that code, one of the things it says is that scientists should have respect for law. Let me just check what it says. It's the law, life and the public good. And I think sometimes we have to stop and think about what the public good is. And life, you know, if you're doing projections, as many scientists did, that show potentially some policies will cost hundreds of thousands of lives, I think it's legitimate to question whether scientists then say it's okay to say, well, over to you, the politicians, this is now in your hands, I'm washing my hands of it. So I think there are some sort of reflections on the science policy ethics interface there. You know, is it complicity if you don't say very strongly that policy is unethical? And just I think the other thing is there is a plea, I think, in terms of communication for all of us to get outside our comfort zones and talk to people that are not like us. And that goes back to the point I made earlier about communicating with populations that are very different, perhaps from, you know, that live different lives. And there are two things that struck me, I think, in the pandemic, two conversations that stayed with me. One is that when the JCVI were looking about rolling out the vaccine, one of the obvious priorities was to give them to high-risk populations. And we know that COVID disproportionately affects ethnic minority populations. So one possible policy was to roll out the vaccine to ethnic minorities first. And I thought, you know, actually naively thought, well, actually that might be a good idea. And then when I actually spoke to people about it, they were horrified because they thought, well, the reason we might be offered the vaccine first is because we're the guinea pigs. And I just hadn't thought of it like that. And bringing those in, I wanted to sort of give a shout out to the Vaccine Confidence Project for you know, kind of encouraging people to look widely at how policies are sort of play with different groups of people. I thought that was, I really wanted to credit their work and the work of Sonia Saxena at Imperial, who I talked to about the disproportionate impact of COVID on BAME populations. And the other, just to finish, the other conversation that I had very early on in the pandemic was when I went to a supermarket and was talking to a cashier, and it was just after lockdown, and people were very nervous, you know, everyone was masked and, you know, sanitizing like mad and so on. I was talking to this cashier and saying, thank you for, you know, continuing to work and serve all of us that are coming in. And, you know, I was going out once a week just to get the shopping. And I said to her, well, you're really lucky, you're a key worker, and that means your kids can still go to school. And she said, well, actually, if Eton aren't open, I'm not going to send my kids to school. If it's not good enough for the Eton boys, my kids aren't going anywhere near a school. And I just thought how differently we looked at the world. You know, this idea that if you could keep your kids in school, you're winning. But actually, it just made me think just how many other perspectives we often don't draw on from our very sort of narrow sort of backgrounds. And I think I'm going to leave it there. Thank you, Fiona.
Thanks, and that was a great way to start this session. Lots of points, but all of them fascinating and all food for thought. So we'll pick up on those in the discussion, I'm sure. Right, so over to our second speaker, Professor Christian Drosten. I'm sure you all know of him. He is a leading virologist from Germany, and as head of the German Public Health Institute's reference lab on coronaviruses, he became well known globally as the German government's go-to expert on COVID-19, and has had probably an amazing 18 months, challenging, I imagine. So, Christian, I've got loads of questions for you after, but over to you for your introductory comments.
Yes, thank you, Fiona, and thank you, Anjana, for this really interesting insight. This was really helpful. So I'm a virologist, and I'm not in an, well, not in an official government advice function. And this may sound odd to you from a UK perspective, but in fact, we do not have any official board or other entity that advises the government, except from our top public health institution, the Robert Koch Institute. They have this on their to-do list, obviously, their official list of duties to advise the government in public health matters. But then, well, policy advice in Germany is somehow not as organized as in the UK, and this creates an interesting situation. So for me, for instance, I had been somehow on the media sometimes, also in connection with coronaviruses and other similar problems. So the media turned to me in the very beginning, and at some point it turned out this is not manageable anymore, and I decided to somehow start a more regular format of communication, which is a podcast that turned out to be helpful, especially in the beginning in Germany, to somehow, well, provide a perpetual and updated, well, assessment of the situation from a single scientist's perspective. But that was, I guess, received widely. And for me, as a scientist, as a person, it was interesting for Anjana to mention this plea for scientists to speak up. Well, I took the personal decision to just make a difference there, right? So instead of like prioritizing on big grants or big publications, I thought you can make the biggest difference as a single individual scientist by informing the public about this, well, overwhelming problem for everybody. And what I wasn't really aware about is the role that the media plays. So, I mean, Anjana somehow presents the media as, well, this is our area of responsibility, but beyond this, there's politics, and before this comes the public, and we are somehow interpreting. I'm not sure whether I can really agree on this, this clear delimitation of the role of the media in the whole thing. So, I mean, the media somehow they are perceived as a fourth power in the state, right? So you have the legislation, the law execution, the jurisdiction, and then you have the perception, right? So what the media do is they generate our perception of the reality. This is, well, somehow reflected in the separation, and that's like a self-control function in the media, separation of news from opinion, right? So you should separate these two matters to, well, to transport an impression to the public that is not biased by personal opinion. But as we all know, the media are not always precise in this approach and in this function. That's one of the issues. The other issue probably is that we as scientists are also not this precise, right? So we should in fact report back the scientific facts, communicate the unknowns, and well, provide a reflection of where actually the frontier of knowledge is. But in fact, many scientists just transport a private opinion. You can sometimes see who has kids in school and who doesn't, right? In all of these discussions in some matters. This is, well, I wouldn't say this is good practice. And well, good practice executed by both the media and the scientific community at large. There are some phenomena, especially in the, let's say, in the entertaining parts of journalism, right? Like looking at talk shows, we have this this problem of false balance, where you have 200 scientists agreeing on some matter, and well, two going against this opinion, and well, one of the two and one of the 200 are then opposed in a talk show, and they get 45 minutes to fight. And we are all watching, right? So that's like actually it's entertainment. It's not journalism, it's entertainment. But we like to be entertained, and because we confuse this with journalism and with the function that journalism universally has to create our perception about reality. Well, we adopt this impression that actually scientists are always fighting, and you can just pick one and get one opinion, and pick another, you get another opinion. But that's not the case. So this is how the false balance thing works. And I perceive this as a real problem. The other is, in science, we have actually two things that we cling to. We should cling to evidence exclusively, but in a process like a pandemic, there is no evidence for many things. Evidence is being created as the events happen, and only months later we have formal evidence in the scientific literature. So we have to add another component, which is domain expertise, right? The question is, who is in the right domain? Who is the expert you should turn to? And there is another, maybe a third component of a triangle, which is common sense, right? But common sense in our way, in our, let's say, daily life, which is a linear life, right? We compare prices on a linear scale, and body weight and the speed of cars happens on a linear scale, but the exponential scale of a pandemic doesn't translate into what we perceive as common sense decisions in many cases. But the public discussion somehow has to juggle with this triangle of domain expertise, scientific evidence, and common sense. And politicians often turn to common sense decisions, right? And because these are easily explained to the public, to the voters. So that's really a conundrum of problems that are somehow, at least in my country, not formally addressed. Maybe we will have to go through a period of working after these things and processing these things, while we do not have something that is, let's say, like a SAGE committee or even an alternative SAGE committee that can then form, and you can compare the two and have a clear impression about what's the consensus of science. We do not have this in our country, and most countries do not have this. So this is maybe even difficult for you to imagine from a UK perspective, that this is not in existence, but this seems to be the situation in most countries globally. And this then creates those big men on the TV screen that explain the situation. They can be sometimes confused with politicians, with media commenters, but in fact they are scientists. And this really creates a danger of disinformation. This creates low vaccine uptake, our biggest problem currently in many countries, in many industrialized countries. Yeah.
Chris, can I draw you to a close there? Is that all right?
Yes. Yes.
It's absolutely fascinating, but I just want to make sure we've got time for discussion, and so thank you so much for that. I mean, really, that triangle of issues is exactly what I want us to be talking about. So let's come back to all of those. So final speaker is Nyka Alexander. Nyka is a former broadcast journalist who now heads up the WHO's communication team working on emergencies. So must have had an incredibly busy 18 months and some insights to share with us. Thanks, Nyka.
Thanks, Fiona. It's actually been 22 months. I sometimes look back on my screen grabs of messages coming from colleagues on the 31st of December 2019. WHO set up its incident management system on the 1st of January 2020, and I was on leave, although on call, and then my first day working on what came to be COVID was the 2nd of January 2020. The incident management system is something WHO sets up when there's an emergency that we need to pay attention to. I'd say a couple times, 3 or 4 times a year, we'll set one up. We have ones on Afghanistan and Ethiopia at the moment, for example. And in incident management system, you'll have representatives of communications, which is what I do in that team, logistics, clinical care, infection prevention and control. Because we're WHO, we have an international health regulations focal point as well, data and epi. Over time, we added health systems colleagues, vaccines colleagues, as you can imagine, and then we have people from other organizations like UNICEF and Red Cross who also work embedded in that incident management team. Slowly in that first month, more and more colleagues started joining in communications. I remember going to my boss and saying, we're going to need a bigger boat. We're going to need more web people. We're going to need more social media people. We're going to need more of everything because this is something big. And as you know, by the 30th of January 2020, WHO had declared the public health emergency of international concern, which was our loudest alarm bell. Although some people didn't really hear it until we used the word pandemic a little while later. And so that's one of the learnings for us. It doesn't matter in a way that was our largest alarm bell. If people didn't hear it until we use that other word, then what do we need to reconsider? So that's something that we learned. Neil mentioned the burgeoning interest in science, and goodness, there's been an overwhelming wave of interest and people just so intensely turn towards us to hear what we have to say. So one thing that we pivoted on, we started doing daily press conferences in the beginning. It's continued on. Now we have a weekly COVID press conference, but that means that I've worked with the Director General, Dr. Mike Ryan, Maria Van Kerkhove, to prepare them for 200 press conferences up until now. So it's just been an intense amount of interest and need for us to communicate. But as Ange said, and as Christian said as well, communicate what? When the science is still evolving, how do you communicate that in a credible way? Because you're the World Health Organization, you're supposed to know things, but the science isn't there yet. We're convening the experts, we're looking at all the papers that are coming out, we're evaluating the papers with all these experts, but there isn't clear consensus, not because we're disagreeing with each other, but there's just not enough information to come to a consensus. And at the same time, we know from social science that when people are stressed, they don't want shades of gray. They want to know, should I do this or shouldn't I do this? They also don't want you to change. They don't want you to say, we're not sure about masks, and then all of a sudden say, you have to wear masks and wear them a lot. People really dislike that. And I kept thinking about the great American economist, John Kenneth Galbraith, who said, it's better to be correct than to be consistent. And there's been a lot of criticism when we changed recommendations, but we're changing that based on the evidence. So we should be changing. And it's been sometimes frustrating for us, as I imagine it is for the public as well, that and for governments especially, that when you change your information, when you change your advice based on the evolving science, people are critical of that. But we always come back to the basics of risk communication, the 101. What are the main learnings from risk communication and how people hear information when they're stressed? And you, as the public health authority, you need to be first. You need to communicate information even though you're not sure of it. You have to say what you know, what you don't know, what you're doing to find out. And when you will be back to people and give them updates. And you need a little bit of intestinal fortitude to do that. Governments often want to be sure. Ministers of health, through the years that I've worked with them, will always want to be sure before they say something. But you can't be sure. You need to give people information as you know it, and then give them the decision for how they use that information. So I think you can't forget that the people themselves are the final arbiters of the information, because they're the ones who use it to make the decisions on what they need to do to protect themselves.
Brilliant. Thanks so much. Thanks to all of you. That was just absolutely fascinating. Right, I'm going to start off with some questions. One that's really close to my heart that you've kind of alluded to as we've gone along is whether we can have any kind of separation, any clear blue water between the science and the politics. And what happened, I think, not necessarily like SAGE, but there was a kind of recruiting independent university scientists to the national effort. So the government would fund them and commission data from them for these big, prevalent studies, serology studies, clinical trials, etc. So it was like the university scientists were no longer university scientists, they were working for the national effort. And I think that was fantastic for the country, for the government to get those independent scientists. But the downside is because the government commissioned it, it got subsumed into the government communication system. So the decisions about how that data was put into the media and the public domain, when it was put into the media, were made by government press officers, who are obviously responsible for messaging that Anjana referred to earlier about the government's job is to do the public health messaging. And I know there were problems with that. There was sometimes, press conferences we ran that had to be delayed 3 days because they were inconvenient findings or because they wanted to get the Downing Street press conference out of the way. Do you think that was a problem, or do you think that's just inevitable the way it has to be? Do you think there is something we could do before the next pandemic to kind of establish globally even this kind of clear blue water between government who commission independent scientists to do data and the way that is communicated to the public? So shall I start? Let me go the other way around. Nyka, have you got any comments on that?
I actually don't, because it's very different from how WHO does the work. Okay. So it might be a very UK specific kind of situation.
Okay, that's fine. Great. There'll be plenty for you to comment on. Christian, what do you think? Was it the same? Was German government commissioning scientists in German universities and institutes? You're on mute. You need to come off mute, Christian.
I'm sorry. I do not, I have to admit, exactly understand how this commissioning process works in the UK. When I look at the whole thing from the outside, I wish we had something like this in Germany. So in Germany, we have this odd university press office selling a press release of one of the latest studies, and then causing a big confusion, also disturbing public health messages, and sometimes causing government entities to have to comment. Media somehow chasing after the originators of the data, chasing after politicians, how to deal with this. So a more organized process would be very helpful. And I've always perceived the SARS and then also the alternative SARS that you have as something like this, an alternative, an organized process. And well, this SARS, for instance, with putting decisions and consensus in writing, right? And like defining categories of evidence, right? Whether you are sure or whether you're very sure or a bit uncertain, to define these categories. All of this is extremely helpful, and all of this is absent in most countries.
So, Christian, I know you did quite a few press conferences with the health minister in Germany, didn't you, at the outset? And there's been big questions in the UK about whether Patrick Vallance and Chris Whitty should have been at those Downing Street press conferences, or whether that inevitably kind of leads to the politicisation and this lack of what I'm identifying as a lack of separation between the government policy and the evidence on which that's based. Do you reflect on that?
So I'm not like, let's say Chris Whitty. I'm not a chief scientist. I'm just a university professor. We have obviously a president of the Robert Koch Institute who joins our Minister of Health very regularly for those press conferences. And these are press conferences actually organized by the Ministry of Health, not by the government. And well, there is a changing panel of guests from the scientific community with these press conferences. Most of them cover some or another aspect of the scientific research around the pandemic. And let's say the president of the Robert Koch Institute, because of his official function to advise the Minister of Health, is like a steady participant. But this is probably not a comparable level to what you're referring to now in the UK government.
Yeah. Okay. And any thoughts on this?
Yes, because I think it's a really difficult one. And I think sometimes particularly when we had, I didn't have any problem actually with Chris Whitty and Patrick Vallance, the Chief Science Advisor and the Chief Medical Advisor, standing on a podium with the Prime Minister or the Health Secretary, because it was all part of, I think, sort of tight public health messaging. So you had two strands working together, which is the science, the public health, and then that feeding into the decision-making process, you know, the executive who are actually making the decisions. And, you know, I think there's a benefit from standing back and seeing the wood for the trees. What is the purpose of government? The purpose of government is to make the decisions about how we all live, about how our liberties will be restricted and so on, about how you know, and they will take advice. But then what is the purpose of being a scientific advisor? And referring to Christian's, you know, this idea of domain of expertise, I think sometimes scientists, you know, you can always benefit from going back and trying to think clearly about what your role is in this pandemic. So the scientists could sort of step back. I think it's very sensible to step back, and there were some people that did it very well, like Jonathan Van Tam, who everything he said, even if he was saying it on a podium next to a politician, all came sort of from the first principles of public health. How do you cut transmission? He wasn't saying that politicians should lock down, but he was explaining how diseases spread. Mm-hmm. He wasn't saying that people, you know, that it would be right for, say, teachers to be vaccinated first. You know, how are we going to roll out the vaccines in a way that are going to cut hospitalizations and deaths? So it's about going back to first principles, about remembering what your function is in this pandemic or in a public crisis, and thinking clearly, how can I contribute to the public discourse and the public conversation, which is true to my principles, true to my expertise, and true to an ethical code. And again, I go back to this code that is on the government website, the government's own website, that says how it's about having rigor, respect, and responsibility. How can I fulfill those on a public stage while respecting the fact that the government makes the decisions? So it's about having that sort of clarity of mind about why you're in the public space, what you're trying to achieve by being there, and being aware that, you know, sometimes it's about saying these decisions are not for me. I'm a scientist, I provide the advice. These are for others to make, but here are the implications. And you can do that in a way that doesn't set you up as partisan, I think.
So can I come back to something that Ange and Nyka spoke about in terms of this kind of single public health messaging? Because I find that really tricky. I know you make the point, Ange, that it's important, it's the government's job. I know I've been told many times in the past, I'm not sure how strong it is, but there is hard evidence that shows that single, clear public health messages are good for the public interest. And yet you've both said very clearly, I mean, Anjana, you said there was no science. I mean, it's ironic because the government said repeatedly for 6 months, we're following the science. And you're saying there was no science with a capital S. There was no consensus. And Christian, you made that point. And Nyka, I thought you were actually going to say the important thing was single public health messages, but you actually were not concluding that, I don't think. You were saying that if they are not there, better to be correct than be consistent. And actually, I'm really interested in that, because I had a couple of government comms people coming to us and saying, you're not being very helpful here. You've got all these different scientists on your panels, all disagreeing with each other, all saying they don't know anything yet. And the public need these clear public health messaging. So if you were me, what would you have said to those government people? You can't say you're wrong to want them. Because we know that that's what the public want and need. But should science be complicit? Should scientists get round the table and say, actually, let's be a bit more clear and let's work with the government to define these simple public health messages? Or do they just go on being sciencey and having their disagreements in public? Or is that harmful? Let's go around the other way this time. So Ange, start with you.
Well, there's a question of transparency and complicity. You're quite right, and I think it is very difficult. I I can sort of see the need for a consistent type public health message, and I would advocate it if the consensus is, you know, we have things like the precautionary principle. So, for example, on masks, we're very slow in this country to pick up on mask wearing. Well, there are other countries that have done it for years. In the flu season, it's a respiratory virus, it's airborne. So, you know, that I think sometimes we had angst over things that we didn't need to have angst over. The other thing about the other thing is that government is about leadership, and it's about stepping up and making a decision amid uncertainty, and that is what, you know, leaders are meant to do. And so as to whether you have the scientific debate in the open, I think actually I'm all in favour of transparency. I think we have to. I don't think you can have a sense of scientists sort of cozying up with politicians to craft a message that, you know, that is still sort of shrouded in uncertainty without spelling out what those uncertainties are, because I think in that way you damage trust for the future. Because if it turns out that actually you need to change policy, then you need to be able to do that in a way that, you know, you can bring people with you, and that means, you know, scientists keeping a measure of trust. And I just want to sort of, you know, make the point, and I'm sure it's not lost on lots of people here, is that, you know, politicians hate U-turns, but they are, you know, they're the lifeblood of science. You know, if you don't change your mind when the evidence changes, then what are you doing in science? Whereas for politicians, it's a lot harder. And actually, perhaps we could have explained a bit more clearly about why there were these U-turns. I mean, it kind of irritates me a little bit when people talk about Anthony Fauci being anti-mask at the beginning and now being pro-mask, as if, well, actually things change, and you know, and I think sort of scientists are unfairly demonized for changing their minds. But I think science does need to maintain some independence from, you know, from politics.
Nyka.
I think we shouldn't be being very careful of being factful. There wasn't no science, there was evolving science, right? I remember us getting questions early on, what's the long-term effects of COVID? How long will immunity last? We weren't in the long term yet. You know, people were asking this in the early months. There hadn't been that many people who had the disease in order for the science to be there. So it's not, in a way, the fault of scientists or the communicators. The evidence just wasn't there yet. And we got criticism for saying there is no evidence. And you also have to be careful how you use that non-evidence base, as Anj was just saying. Does that mean there's evidence that it doesn't work, or there's no evidence that it works? And that can be a bit confusing for the public as well. However, I'd say that largely the scientists have not disagreed over the broad strokes, over the most important things, over what people need to do to protect themselves, over basically how this virus spreads. There's strong agreement on that. You can't really get a wedge between WHO, US CDC, Africa CDC, European CDC, and so on. And when there have been small differences, for example, when US CDC changed their mask recommendations that were slightly out of line with the other CDCs and with WHO, we reached out to them and they reached out to us so that we knew we had a heads up that it was evolving, and that we would be able to have an answer if we were asked about it as well. So I think that's also very important, that your credible sources of information are not fighting with each other, and you do that by working together at multiple levels. Your technical colleagues are working together, they're in multiple meetings together, and the communications people are working together in parallel, so that you do have consistent messaging on unclear information in a way. So we're all seeing the same information, generally interpreting it the same way, and concluding the same thing for now, and that may evolve, as Anj said.
Christian, and anything on this? Were you under pressure to kind of agree clear single messages with government? You're on mute, Christian.
Sorry,
okay.
every time I forget this. Yeah, I mean, this is really interesting. So Nyka confirms what actually is in place in the UK. And well, let's look at it like what happens in Germany. So we do not have this type of absolute transparency in policy advice. We do not have the outcome of policy advice panels in writing accessible to the public. So you can imagine how much I like to read through SAGE assessments. We don't have those. There hasn't been a single document like this in the public in Germany. And this is a big country, right? This perception that there is no disagreement over the broad strokes. Well, you wouldn't find convincing evidence in Germany. So last year at this time, we had scientists sitting in talk shows and distributing messages like, well, all we have to do is shield off the senior residence care homes and we can let the whole thing go because it's not a problem at all. It's actually very similar to influenza. This was October 2020. 60,000 people died then in the winter wave. This is, well, it's still a low count as compared to the UK, but the reasons there are on a different level, obviously. So we had a different type of decision making in the central government system. But this, I wouldn't say was all due to science, but there was more attention to some phenomena, maybe really in the government itself. So these rules, like as a scientist, you do not actually make political claims. You just describe the background. You explain how the mechanism of this pandemic works, but you do not have or transmit a personal opinion, right? And beyond this, you try to reach consensus and, well, you transport the results of your discussions in full transparency, and you put this all in writing and make it accessible to the public. This is actually what I wish would have had happened in Germany, and you can speak to many scientists in other countries, they wish the same. So that's really a take home for us in Germany. And I have to say, I've always admired the system there in the UK. And I mean, you find, I don't know, look at the US, you have like people who are really good at what they are doing, but they are still individual people. And you find similar mechanisms underlying in the background of the public discussion, like I am describing for Germany.
Okay, so I'm going to go out to the audience now, and I'm getting questions that I'm going to ask you. I'm going to try and direct them at the people I think would be most appropriate. So, but if others want to wave their hand if they've got something to add, but we haven't got that much time left, so I want to use it well. So the first question is quite funny, given what you just said, Christian. It's from an anonymous questioner who says, thanks for your very positive perspective about SAGE. However, it doesn't seem that it led to better outcomes in the UK compared to countries without such advice, like Germany. Do you have an opinion on this? So I think that's for you, Christian. I'm happy to feed this back to Patrick and Chris, how positive you are, but we have a very large number of deaths in the UK and you've got much less. So something was working in Germany.
Well, it depends on how capable politicians are to actually then take up this type of advice, right? This is beyond the responsibility of scientists. And I mean, you know that in Germany we went with Angela Merkel, who is a trained physicist, who has a clear access to non-linear processes in her way of imagining the epidemic, and who is convincing and who directs a whole board of then local decision makers, and they reach consensus decisions, but they reach those decisions without scientists present. And I guess also the leading decisions in the UK are reached without scientists present. So this is something I can't answer from a scientist's perspective. All I can say is I find a written assessment of scientific consensus something that's really helpful and guiding.
Yeah. Okay. So this is a question from Jim Naismith directed at Anjana. I totally agree. I'm not sure what point he's making there, but anyway, I totally agree. But how do we avoid the media focusing on policy advocates? A pro or anti-lockdown, for example, advocate with a professor title is guaranteed to be praised in one media outlet and vilified in others, but either way gets the attention. The risk of science advocates posing as neutral scientists is very powerful in influencing public opinion. As a result, it drives politicians to attack science and evidence as a means to change policy. So I think as well, Christian, you made this point about sometimes even good scientists, you can tell whether their kids go to school or not. You know, you can tell their opinion and their preferred policy coming through very clearly. So Anjana, that one is.
Yeah, I mean, one of the things that I thought about a lot when covering the pandemic was who I should be platforming and why. And I think I gave that a lot of thought because, you know, I take my responsibility seriously as a science journalist, but as a commentator on the opinion pages, where I get paid to share my opinion, which is supposed to be kind of formed from reading lots of things, talking to lots of people and so on. And it should be, and it is all intended to try to help readers think clearly. I think it's really hard because I think people, you know, on the one hand, scientists get sort of, you know, oh, you should just stick to your domain of expertise and just talk about what you know about. But then you can come across as automatons or robots if you don't then bring in sort of examples from your own life and sort of personalize a bit. So I think it's sort of very much up to individuals about I think they should be free to give their opinion. I mean, whether it's good for them reputationally, I don't know. There will always be media outlets willing to platform people who agree with them. So and it's also really important to remember, and it's something that I think it still shocks me now, because because I used to be a scientist, I think my first sort of perspective, my first lens on the world is scientific. But we have to accept, and you can see it with what's happened in the UK, there are certain sectors, and politicians among them, where their first view on the world will be political or ideological, and everything is viewed through that. So, you know, if you view liberty and libertarianism as the most important thing in the way you work and the way you operate and the way you practice, then of course kind of lockdowns are going to be the absolute antithesis of what you believe in, and you know, maybe you have a different, you know, you have different risk calculations, so it comes down to that too. And it, you know, it is really hard because there are some people, and I think it is legitimate to say, again, if this is about governments stepping up and making decisions, it could be that a government says, well, actually, we don't close down the economy for flu. So once we get to this kind of flu-like levels of numbers for COVID, we may not need the masking and so on. I think those are legitimate discussions to have. I really do. I think as long as people are clear where the consensus lies, what you're trying to achieve by various measures, whether they're lockdowns, masking, whatever, I want to hear all sides of that debate. And I think I would feel sort of worried about certain people with certain scientific opinions being shut down, even if they're quite outrageous. But it's just whether you have the politicians and the ministers that have the ability to discriminate between good information and poor. And one of the things I remember from writing Spike was Dominic Cummings, the special advisor to Boris Johnson, telling me just before lockdown, he'd attended SAGE meetings, and his quote to me was that we had nobody in number 10 who understood how a virus worked. And that, I think, is shocking and puts a lot of the decisions that were then made into context. I don't know, it's quite rambly, wasn't it? But... No,
that was really interesting. I also think, Anjana, it's an opportunity to just shout out for specialist science journalists, because I agree with you. it would be ideal to say that these outliers and these mavericks shouldn't get media until you see what that looks like in practice. That means certain people deciding which scientists are okay and which aren't. And for me, what worked well in the UK was good science journalists who would sometimes use them, but make it very, very clear that they were a minority view or an outlier. So I think the science journalists in countries where they had lots of science specialist journalists really did a service there.
Quickly draw the parallels as well with climate reporting.
Yeah.
So there is a lot to be said for looking at the way climate has been reported for the past 20 years and seeing the same tricks about bad actors using doubt, uncertainty to justify inaction. And it really was very striking to me that these are the two biggest challenges that we've had, sort of contemporary challenges: climate change, the pandemic, and exactly the same techniques come to the fore. And we just need to be wise to it, all of us, politicians, ministers, science journalists, policymakers, advisors. And so, yeah. Yeah,
Nyka, any thoughts on this? And then I've got a question to put to you as well.
Yeah, we've had a few times where we spend time with a journalist or do a very good press conference. The information was quite clear, and then the headlines would start coming in and they'd be wrong. And so we'd reach back out to the journalist and say, this isn't right. And so many times they'd say to us, I know, it's not me. I mean, as we all know, journalists don't write the headlines. So there's that. There's your editor interpreting what you've written in your article. But then the editor has huge pressure to make sure it's a clickable lead, to make sure that that headline is something that will get people to click on it. And that sometimes doesn't align with what a public health goal is. It doesn't align with what's good for people. Scaring people all the time is not necessarily what's good for them. On the positive side, though, some research has shown that people react to emotional headlines, whether they're positive or negative. There's slightly more clicking if it's positive, if it's negative, but you can still get people engaged if it's positive. And that's something we've seen as well, that people have turned to positive news. If just this bad news about COVID washes over you incessantly, you do see that there's an appetite for some good news as well. So conclusion being to encourage editors to also make headlines that are positive, not just grabby headlines that are negative. But that has been a challenge sometimes as well. Not only squeezing that information from an article into the size of a tweet, but the size of a tweet into the size of a headline is quite small.
Yeah. So it's more of a point really from Laura Gallagher here. In the UK, we had some businesses advising their employees to work from home before the first lockdown and before government had asked them to do so, arguably because they were able to access scientific information and scientists' views via traditional media and social media. If all the scientists waited to share emerging evidence until they were approved to do so by government, then that would take away the people's ability to make their own decisions based on best available information. Governments don't always act quickly enough. So I think that's a really good point, isn't it? One of the benefits of allowing a bit of a free-for-all of all these scientists in the media is that, and Christian, you're totally right about SAGE, I think, in how positive it was, but there was often a delay in those minutes. You didn't hear what had happened at SAGE meetings on the day it happened. So in that week, we know a week was a long time in COVID, you actually needed these independent scientists on the airways to inform public opinion. I think that's a good point. Any comments on that, or shall I go? Because I think that was more a comment than a question, wasn't it? Shall I go to another question?
Well, just to say, one of the challenges we have, though, is when one paper comes out with one piece of information, and then if it's interesting enough, it can grab a lot of headlines, but it can also confuse the public because the headlines will be scientists say X. Yet we've been hearing all along that scientists have said Y. So why are scientists flip-flopping when in fact the scientific agreement has not changed? It's just one piece of evidence that's come through that's different from the others, but that confused people. I think it's hard for people in general to be able to know, is this something that a lot of people are agreeing on, or it's just one new paper that's saying this?
Yeah. Question here from Neil Squires. Is there scope to create a transparency index for media outlets? So we have a metric of the reliability of different data sources, assessing use of supporting evidence, presence of conflicts of interest, etc. Anjana, you're the journalist. Can you ever see that happening?
Well, we do have a code of,
the FT with their data. There was a lot of innovation in newspapers during COVID, wasn't there? And data journalism and
And right across, not just in the FT, but I have to say, I mean, I think everyone stepped up. There's so much at stake. I think, you know, that the sort of health agencies, advisors, scientists who went very bravely, kind of braved the public arena, like Christian, to go and do their best explaining, you know, what was happening on a sort of almost a daily basis. In terms of transparency, I mean, we do have codes of conduct. So, and I know, for example, when you run your briefings, Fiona, that, you know, the scientists involved have to declare their conflicts of interest. And there are, you know, egregiously bad sort of press can be complained about. There are avenues to do that. But I think what I'm worried about is this idea of too much censorship. You know, a lot of the comment that went on in the pandemic was exactly that. It was comment. I mean, I think there is a distinction between commentary and news and factual stuff. But again, I sort of make the point that it's really the responsibility of government to ensure, you know, good public health messaging. I don't think it's the job of, I mean, it's the job of scientists and journalists to report responsibly, I think, to comment from a place of having looked at the data and kind of coming to your own conclusions. But I don't think it's the job of scientists and journalists to uncritically regurgitate what governments tell them to say, and to, you know, because there are, for example, I wrote columns once the teenage vaccines were approved for 12 to 15-year-olds. I really couldn't understand the delay in bringing them in and rolling them out to teenagers here, and that was to me, that was worth criticising, and that was, you know, the JCVI decided not to do that very early on. But I think we need that freedom of debate and freedom to comment. I don't think we can be too beholden to kind of one particular kind of, you know, this is the right thing to say. I would really worry about that.
Okay, thank you. Look, we haven't got much more time, so I'm going to get a couple of other questions in. Christian, I think this is one for you, although Nyka may have experience of this from WHO as well. But how much personal attack have you experienced as a result of your media work on COVID-19, and how have you dealt with it? The SMC was involved in a survey recently with Nature magazine with quite shocking percentages of people who did media work who were trolled on social media or sent death threats or whatever. So have you had the same?
Well, I think every scientist who exposed him or herself in the media has been in this situation. There are ways to deal with this. I'm not seeing this anymore, so nothing of this reaches me. This is all being dealt with beforehand.
By who? That's really interesting. By your university or your institute?
I have this organized here on my assistance level.
Okay, well, I'm gonna email you after this to find out why, because I think universities and institutes need to look at what other places are doing to protect you from some of it. Nyka, was this a big issue? Did you have scientists and WHO experts actually stepping back from the media because they just...
We definitely saw, we didn't see anyone stepping back from media. We saw some people stepping back from social media, but our loudest spokespersons, our leaders and our chief scientists have had very personal attacks. The more active they've been, the more reachable they've been, the more they've had been subject to what one becomes subject to on social media. I do want to say, however, the positive side of all these platforms is an ability to listen to the public more. Mike Ryan and Dr. Maria Van Kerkhove, they do the press conference, which is a little bit more one way, you know, we hear from the journalists and then speak, but they both really enjoy doing once a week this social media live that we do that's on Twitter and Facebook and so on. And that's where the public can ask their questions just directly. And often Mike and Maria will say those questions are sometimes even better than the ones they get in the press conference, because the public's not looking for an angle. They're just looking for information they can use. And we also have lots of colleagues who work behind the scenes to do social media listening to really understand what's the public confused about or interested about right now. And that feeds into what we then do in our next social media live, or what we address in the press conference, or what kind of products we're putting out on our social media feed. So there's the bad and the good.
Okay, so final question then, also anonymous. How much did misinformation cross borders? What was the role of social media and instant messaging apps? So I think this is an interesting question to finish on. We've been talking a lot about the traditional news media, but to what extent was the news media, and therefore the public's kind of impression of this, being informed by social media storms and misinformation? Do you think that was major, or do you think actually it was interesting what you were saying, Anj, earlier about a lot of people coming back to traditional sources and subscriptions for the FT going up, and I know that was true of the New York Times and the Economist. So to an extent, do you think maybe people actually did, you know, they had fun on social media, but they came back to traditional news sources that they trust? Or was this the pandemic that, you know, was this the big crisis that really showed the harms of social media? Right, I'll go in reverse order actually and finish with you, and any other final comments you want to make, because this will be your last opportunity. So Nyka, can I start with you and I'll go back?
I think I would just repeat what I said already, that there's the good and the bad of social media. We often were advising people, seek sources of information that you trust. And that's why people have turned to traditional media, where the money and time can be spent to really understand an issue rather than a quick take. Has it been harmful? Obviously, misinformation is harmful no matter what public health issue you're dealing with, and therefore institutions like WHO have had to work even more closely with the social media platform so that we can see how to counter misinformation and what counts as misinformation, what is a strong opinion versus what is wrong and harmful, and that in itself would be a whole other discussion.
Great. Christian, and any other final comments you've got as we close the session?
Well, I can only very briefly say I find it a bit difficult when journalists of some newspapers are very active on social media, and the delimitation there becomes blurry. So they take their information from social media into formal reporting, and then somehow they appear on social media not as a private person actually, but as a representative of a certain news outlet. So this is really a difficult situation to deal with.
Mm-hmm. Mm-hmm. And any final comments on this session, like your kind of key lesson that you would want to take?
I mean, when you think about what happens in a crisis, you kind of retreat and you go to the people that you trust, perhaps the people that you're closest to, the people that you spend time with, and those might be Facebook groups, hobby groups, family, school groups, and in fact, I've had a lot of sort of school parents coming to me saying, you know, I've heard on this Facebook group that, you know, that this happened when their kid got the teenage vaccine, and there are a couple of things that there, and you've got to remember that bad stories spread much better than good ones on, you know, there's a selection bias of the stories that spread on social media, so that can bias what's going on. And I think people have learned that sort of critical thinking is important, and that social media has its limitations, but it also has its advantages. I mean, I think it's great that academics stepped up and actually sort of did Twitter threads on complicated science that I have referred to, because they're in the public domain, and that's perhaps sometimes, you know, people forget that, is that all these things, they are in the public domain, they are there for public consumption, and some of them have been really, really useful for helping people think about what is, you know, a real crisis.
Great. Okay. Thank you so much. That was just a fascinating panel, I think, and thanks actually for being incredibly positive. It does feel to me like when we have our various inquiries and our lessons learned, that the overall picture of science communication during this, and thanks to people like you, Christian, who decided, as you said very early on, that it was a part of your role to step up and start your blog and your podcast and engage the German public about the virology of this. And I think that so many other scientists did that. For me, what will be interesting is if we take that through to the next if the next crisis is something that's very different, like ClimateGate or Novichok, or something that's not a pandemic, whether scientists will see their responsibility in a similar way, and I really hope they will. So thank you to all of you. You've brought your fascinating perspectives, a lot of consensus there, and I think definitely take Anjana's point about the risks of multiple voices and disagreement far outweigh have I got that wrong? The benefits of multiple voices far outweigh the risks of some kind of censorship of these voices. So I think let it all hang out, and overall I think we can rely on the journalists and the press office and the scientists to point us to the best evidence, and I think we've done that successfully. So thanks again to the organisers of this event for putting communication right up there, the first session of the day, really important issue, and thanks to our panel, and hand over to Nick Robinson, who I think is the next chair.